Have you ever found yourself unable to focus? Your mind buzzing with 100 different thoughts, yet unable to land on any single one? Perhaps you felt a persistent internal restlessness, a need to move, or a general sense of being on edge, even when there's no immediate threat. Maybe you struggle with sleep, or find your emotions swinging wildly. If so, you're certainly not alone. For many people, these experiences can be incredibly confusing because they could be signs of different yet profoundly impactful conditions. Today, we're going to talk about two of the most prevalent: attention deficit hyperactivity disorder, or ADHD, and anxiety disorders. What makes this topic so important and at times so challenging is that ADHD and anxiety frequently present with remarkably similar symptoms, making it incredibly difficult to tell them apart, even for the individuals experiencing them. This isn't just a clinical curiosity, it creates significant challenges in getting an accurate diagnosis and, crucially, the right kind of support and treatment. ADHD, at its heart, is a neurodevelopmental disorder. It's about a persistent pattern of inattention, hyperactivity, or impulsivity that affects daily life. Think of it like your brain's internal regulation system having a few unique quirks, particularly in managing attention and self-control. Anxiety disorders, on the other hand, are a group of conditions defined by excessive and persistent worry, fear, or dread that significantly disrupt a person's life. It's a chronic alarm system, often triggered by internal thoughts rather than external danger. While these definitions sound quite distinct, their outward manifestations, the things we see and feel, often overlap in ways that can be incredibly perplexing. So let's peel back the layers and understand why these two conditions can look so much alike and what truly sets them apart. First, let's explore those overlapping symptoms, the common ground where ADHD and anxiety can feel almost indistinguishable. One of the most common points of confusion is difficulty concentrating or inattention. Both conditions can make it hard to focus. Imagine trying to read a book, but your eyes keep darting off the page, or your mind drifts off mid-sentence. For someone with ADHD, this inattention might stem from an inability to regulate their focus, being easily distracted by sounds, sights, or even their own internal thoughts. It's like their brain is a constantly scanning radar, picking up too many signals at once, even in a calm room. For someone with anxiety, however, that difficulty concentrating is typically due to a mind preoccupied with worry. Their thoughts are consumed by what-ifs, future fears, or replaying past mistakes, making it impossible to truly engage with the task at hand. It's like having a loud, urgent conversation happening inside your head that demands all your attention. Then there's restlessness. Individuals with either condition often describe feeling uneasy, on edge, or having difficulty staying still. With ADHD, this restlessness often involves a literal need to move, fidgeting, pacing, or feeling an internal buzzing energy that makes sitting still almost painful, particularly when bored. It's a physical manifestation of an overflowing internal engine. In anxiety, restlessness is often linked to that feeling of being on edge, a mental agitation that can translate into physical tension or a pervasive sense of dread, like being perpetually ready to bolt from an unseen threat. Impulsivity is another interesting overlap. While it's a core feature of ADHD, often manifesting as speaking without thinking, making quick decisions, or acting on urges, anxiety, especially under heightened stress or panic, can also lead to impulsive actions. Imagine someone making a hasty decision to avoid a perceived threat, or lashing out because they feel overwhelmed by fear. It's driven by a different internal mechanism, but the outward action can look similar.
And who hasn't struggled with sleep disturbances? Trouble falling or staying asleep is a common issue for both. For ADHD, racing thoughts, difficulty winding down a hyperactive mind, or an inability to stick to a routine can make sleep elusive. For anxiety, it's often a mind that won't quiet down, consumed by worries that amplify in the quiet of the night, keeping sleep at bay. Finally, emotional dysregulation, difficulties in managing emotions, can be present in both. This can look like mood swings, irritability, or an intense reaction to seemingly minor frustrations. For someone with ADHD, this can be linked to challenges in emotional control, processing speed, and executive functions. For someone with anxiety, constant worry and stress can make them feel easily overwhelmed, irritable, or emotionally drained, leading to outbursts or intense emotional responses. So, if the symptoms can look so similar, how do we begin to tell them apart? The crucial distinguishing factor lies in understanding the root cause or the driver of these symptoms. Think of it like two different types of cars making a similar engine noise. The sound might be the same, but the mechanics under the hood are fundamentally different. Let's revisit inattention. In ADHD, it's about a regulation problem. The brain struggles to direct and sustain focus, easily getting sidetracked by novelty or internal distractions. In anxiety, it's about preoccupation. The focus is sustained, but it's stuck on worries and fears, leaving no mental bandwidth for anything else. The thought patterns are also distinct. Anxiety is characterized by repetitive, fear-based worry cycles, often spiraling. ADHD, conversely, involves disorganized, scattered thoughts, sometimes racing alongside that pronounced distractibility. One is a tunnel vision of worry, the other is a broad, uncontrolled spotlight. Now, to complicate matters further, we introduce the concept of comorbidity. This simply means that these two conditions often occur together. It's not uncommon. Estimates suggest that anywhere from 25% to a striking 70% of individuals with ADHD also experience an anxiety disorder. This high rate of co-occurrence severely complicates diagnosis and, naturally, treatment. It's not just a coincidence either. There's often a bidirectional relationship. What does that mean? It means ADHD symptoms can directly contribute to anxiety. Imagine living with the constant stress of executive functioning difficulties, always running late, missing deadlines, forgetting things, struggling in relationships because of impulsivity. This chronic stress, the feeling of constantly falling short or facing criticism, can naturally lead to significant worry and fear, developing into what we sometimes call secondary anxiety. In essence, the challenges of living with untreated ADHD can make a person anxious. Conversely, severe anxiety can exacerbate ADHD symptoms. If your mind is constantly consumed by worry, it's even harder to focus, organize, or manage your time, further impacting your executive functions. It's a vicious cycle where one condition can amplify the struggles of the other. This complex interplay leads to some significant challenges and debates in the professional community, and certainly for individuals seeking help. One major point is diagnostic ambiguity and misdiagnosis. It's incredibly easy to misdiagnose someone with the inattentive presentation of ADHD as having only anxiety, or vice versa. This is especially true for females with ADHD, where anxiety symptoms can often mask the underlying ADHD, delaying an accurate diagnosis for years. Think of it like looking at two plants with similar leaves. You need to dig deeper to see their root systems to know what they truly are.
Then there's the question of optimal treatment sequencing when both are present. Which do you treat first? General clinical guidelines often suggest addressing the ADHD symptoms first, as gaining better control over them can sometimes lead to a significant improvement in anxiety. If the anxiety is secondary to the ADHD challenges, then alleviating those challenges can naturally reduce the anxiety. However, there are concerns that stimulant medications, commonly used for ADHD, might exacerbate anxiety in some individuals, necessitating careful clinical judgment. In cases of very severe anxiety, treating it first might be the necessary initial step. It truly requires a personalized approach. And this brings us back to distinguishing between primary versus secondary anxiety. Is the anxiety a standalone condition, or is it a direct consequence of the chronic frustrations and difficulties of living with untreated ADHD? Understanding this origin is crucial for effective treatment. This whole discussion is made even more critical by the rising prevalence of both ADHD diagnoses in adulthood and a global increase in anxiety disorders, potentially exacerbated by factors like the COVID-19 pandemic. More people than ever are grappling with these symptoms, and the need for clear explanations and accurate diagnosis is intensifying. Many individuals simply don't understand the true root of their struggles, feeling lost in a sea of overlapping symptoms. So, what does this mean for you or someone you care about? It means understanding that while ADHD and anxiety can present with remarkably similar outward signs, their internal drivers, their whys, are distinct. It means that if you're experiencing these symptoms, the journey to feeling better truly begins with a thoughtful and thorough professional evaluation. A skilled clinician will help to untangle that knot of symptoms to identify whether you have ADHD, anxiety, both, or neither, and crucially, to understand the relationship between them. The good news is that with increased awareness and ongoing research, our understanding of these complex conditions is continually improving. Management often involves addressing both conditions, frequently incorporating therapies like cognitive behavioral therapy, or CBT, which is effective for both. The continuous work by researchers and clinicians aims to refine diagnostic accuracy and enhance therapeutic outcomes.
Ultimately, understanding the subtle yet significant differences between ADHD and anxiety is not just an academic exercise. It's the pathway to getting the right support, implementing effective strategies, and truly improving quality of life. If you suspect you or someone you know might be struggling, please reach out to a healthcare professional. You don't have to navigate this complexity alone.